Hi, Amanda.
Hi.
My name is Dr. Mad. I'm here to do your exam.
Nice to meet you.
Nice to meet you too. Thanks for coming in. Since I don't have medical records for you, can you please state your full name and your date of birth? We're just going to create a new file for you.
It's Amanda Jackson and July 2nd, 2000.
Okay. Do you have any allergies to medications? No. Okay. And when was your last physical?
About a year ago.
Any concerns that you would like me to address today?
No, just like a yearly routine.
Okay. Are you taking any medications on a daily basis? When was your last gynecology exam?
Last year.
Okay. What about dental?
Like a few months ago.
Okay. Alright. Do you wear contacts?
Yes.
Okay. When was your last eye exam?
Maybe 6 months ago.
And how often does your prescription change?
It doesn't really change that much anymore.
Okay. Alright. Have you noticed any bumps or itchiness or eczema on your body?
No.
Okay. And are you experiencing any blurry vision, any peripheral vision loss, double vision? Okay. Have you noticed any changes in your voice?
No.
Any flu-like symptoms?
No.
Okay. Any changes in your muscle tone or balance? Okay. Are you experiencing any pain right now?
No, not really.
Okay. And have you had any surgeries in your lifetime?
Yes, I have.
Okay. What surgeries?
I had surgery on my elbow.
How long ago was that?
Like 15 years ago.
Okay. And which elbow is it?
Left.
Was that from an accident?
Yes.
Okay. Any other injuries?
No.
Okay. How many hours per night do you sleep?
Like 7 to 8.
And is that enough for you to feel rested in the morning?
Yeah.
And what kind of diet do you have?
I'm a vegetarian.
Okay. For how long have you been a
10
vegetarian?
years.
Are you taking any supplements?
No.
Okay, we're definitely going to check your B levels. It's very common for vegetarians and vegan people, those who follow a plant-based diet, to have a deficiency in vitamin B. So we just want to make sure that everything looks good. Do you drink coffee?
No.
And what about alcohol?
No.
And do you smoke?
No.
Perfect. Let's see. Family history. Do you have any family history of heart problems?
No.
All right. I believe I have everything. Let's go ahead and start with your vital signs. going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
No.
All right, 96.4 Fahrenheit. And I'm going to check your blood pressure. Is the left arm okay?
Mm.
All right. Perfect. I'm going to have you relax and uncross your legs. Okay. This will go on your arm. Blood pressure is 110/70, which is very normal. I'm going to go ahead and slide this down. Let's go ahead and check your pulses. So I'm going to put 2 fingers on your wrist.
Mm-hmm.
Okay, now I'm just going to go ahead and compare. Good. Strong and symmetric. Temperature was 96.7 Fahrenheit. Respiratory rate is about 16 per minute. Blood pressure 110/70. Heart rate was 75. Alright, perfect. I'm going to start with a vision check. Go ahead and look straight here at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation. Good. I'm just going to go ahead and lower your eyelid and take a look and see if there is any yellowish discoloration. Okay. I'm going to have you close your eyes and I'm going to try to open them. Don't let me do that. Good. Now go ahead and lift your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, perfect. Now go ahead and look right here. All right. Now look here. Okay. Go ahead and give me a big Not seeing any redness. Tongue looks pink and symmetric. Go ahead and give me a big smile. Good. So that's symmetric. And now frown for me. All right. And puff your cheeks. Keep them puffed for me. Don't let me unpuff them. All right. Relax. A little bit of asymmetry there on the right side. We're going to check your muscles there too in just a second. Let's go ahead and check your nose now. Okay, I'm going to have you look up. So we're looking for obstruction. Okay, that looks good. That looks normal. Let's go ahead and check your ears as well. I'm going to have you look towards your right side and relax. The tympanic membrane is pro-gray. There's no signs of infection. A little bit of obstruction here. We could definitely go ahead and remove some of that earwax. I'm going to take some measurements. So first we're going to start with head circumference. Good. Going to check the shoulder length. Okay. And just go ahead and extend your arm like this. I'm going to measure your arms. And the other side. Okay. And now check the circumference of your arm. So we're looking to see if there is any asymmetry in between them. Okay, I'm going to check your waist as well. Go ahead and place your arms a little bit to the side. Okay, good. And relax. Okay. Perfect. I'm going to check your reflexes now. So we're going to start with the jaw. I'm going to have you relax your jaw a little bit. So kind of like this. Perfect. Okay, good. Okay. Go ahead and relax your elbow. This is the elbow that you had the accident on. Okay. Good. Relax. Okay, relax your arm. Good. Perfect. Okay, wonderful. So I'm gonna have you turn around and I'll take a look at your back now, okay? I'm going to go ahead and put gloves on. And first I'm going to take a look at your back. Now put your hair up in a bun just so that we can take a look at the spine. Sorry. I'm going to start by palpating, looking at the cervical spine. Noticing a little bit of lordosis and the thoracic area. Let me know if you experience any kind of pain as I'm pressing down. And I'm not noticing any other signs of abnormal curvatures. No scoliosis. Doing some measurements on the upper spine. It's going to feel a little bit cold. Slight swelling as I'm moving up the cervical spine. And it diminishes as we're going towards the thoracic area. Slight asymmetry between left scapula and right. So I'm going to keep an eye on that and see if it changes in the next 6 months. I'm going to touch you on the right and left side of your spine. Go ahead and tell me if you feel this on the right or left.
Right. Right. Left. Left. Right. Left. Both. 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 Right. Left. The middle. The middle. The middle.
Okay, that was very good. Next, I'm going to draw some shapes and letters that are pretty common. So I need you to tell me if you can distinguish, and we're looking at how well your brain can perceive the stimulus. This is going to feel a little bit wet, okay?
Mm. The circle. Two. Oh, there's more. A square. An A. I don't know.
Okay.
A V. I don't know.
Okay.
A C. A V.
All right. That looks good. I'm going to go ahead and wipe that. Okay, perfect. Okay, I'm going to go ahead and remove the ponytail, so we're going to take a look at your scalp. Looking for any lice infestation, also eczema, and any skin disorders that we can definitely treat very easily in the office. So I'm not noticing any signs of parasites. We can go ahead and just take a look at the skin. Okay, I'm gonna have you lay down, and I think that's when I'll be able to take a look better at your scalp. I am noticing a little bit of redness. Any increased itchiness or dryness of the scalp that you've noticed?
A little bit, yeah.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold.
Did that change in intensity?
No.
Stay the same. Okay. Now go ahead and tell me if you feel this sharp or dull.
Sharp.
And do you feel this sharp all the way?
Yes.
Did that change in intensity?
No.
I'm going to take a sample and we're going to send this to the lab. Since I'm noticing that redness, I just want to make sure that there's nothing concerning. And if there is, we're just going to get a proper treatment and know exactly how to heal it. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
And does this feel cold or warm?
Cold. Warm.
And do you feel this sharp all the way?
Yes.
What about now?
No.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. No. No.
Okay. I'm going to palpate your ears first, and then we're going to check for any auditory deficiency. We're checking for mastoiditis, which is the bone right behind your ear. Sometimes the only sign of that type of infection is just some tenderness that is behind on the bone, and there doesn't seem to be any inflammation. Going to slowly palpate your ears. I'm not feeling any nodules, which is good, on both left and right. Go ahead and tell me with which ear you hear the sound.
Right. Left. Both.
Okay. Now go ahead and tell me when you don't hear the sound anymore.
Now. Now.
And tell me which position here is louder, position A or B. So this is position A, and this is B.
B.
And this is position A and B.
A.
Kind of slowly palpate your nose and then moving to the sinuses. I'm not feeling any swelling. And there's another set of sinuses right in between the eyebrows, a little bit above. Hairline looks intact. I'm not seeing any signs of alopecia. Checking lymph node placement to see if there is any signs of inflammation. We're looking for any nodules. So we're palpating preauricular lymph nodes and postauricular. Also submental right under the chin. I'm going to check for any TMJ disorders. So I'm going to have you slowly open your mouth as wide as you can and slowly close it as soft as you can. I'm not feeling any clicks there. Normal hair distribution of the eyebrows. Eyelashes also look normal in size. The eyes are symmetric. Not feeling any swelling around it. Good. We're going to go ahead and check your sense of smell. So that's your olfactory nerve. I have here an essential oil smell. Go ahead and try to take a deep breath into your nose and out through your mouth. And see if you can identify that smell.
I don't know what that is.
Okay. I have here a few more so we can definitely make sure that the test is accurate. Go ahead and see if you can identify that.
Mint.
Okay, that was close. I do have one more. What about this one?
I don't know what that is.
Okay. Let's go ahead and check your taste. I'm going to place a drop of this essence on your tongue. I'm going to have you identify it, okay?
Mm-hmm.
Go ahead and open your mouth. Good.
I don't know what that is.
Okay. We're definitely gonna have to do more tests and see exactly why that is happening. I'm going to go ahead and check your abdomen and skin now, okay?
Mm-hmm.
I'm going to go ahead and listen to your heart. Okay, I can hear only S1 and S2, no S3, no S4. We're listening for any murmurs now. I'm gonna have you take a deep breath in and hold it for 3-4 seconds, okay? And hold it. And breathe out. Okay. Everything looks good. I'm going to listen to your lungs now. I'm gonna have you take a deep breath in and exhale. And again, breathe in and exhale. Good. I'm going to listen to the sides as well. Breathe in and breathe out. And again, breathe in and breathe out. Okay. I'm going to check the skin on your arms, okay? I'm definitely noticing the scar here on the left elbow. I'm going to lift your arm up a little bit. Okay. I'm going to check the skin. We're looking for any raised bumps. Capillary refill is within 2 seconds. I'm not noticing any splinter hemorrhages. So there is no bulbar erythema. No signs of vitamin B deficiencies. going to go ahead and check for any raised bumps. There's one right here on the right elbow, but it looks normal in size, and I'm not seeing any abnormal discoloration. I'm just going to write that in your file and take a look at it in a few months. Okay, we're going to take a picture of this and save it in your file. Okay. Now we're gonna go ahead and check your legs. Just going to slowly palpate. Let me know if you feel any kind of pain. We're looking for asymmetry and changes in temperature. Checking pedal pulses. Good peripheral circulation. Capillary refill is within 2 seconds. Normal temperature. And I'm not seeing any edema. Okay. Again, we're checking to see if there's any skin moles, lesions that would require attention. There is one right here on your foot. We're going to go ahead and take a picture of that as well. Keep it in your file. Just gonna watch it and see. Going to look in between your toes to see if there is any eczema. I'm going to do the Pinsky reflex here. Just relax. Good. And one more time on the left side. Good. I'm just going to have you push your pads towards you, okay? Towards you. Towards you. Like, so push your legs. Pull your legs towards you. Perfect. And now push with the pads away from you. Both of them. Okay, good. I'm going to slide my hands under your heels and then go ahead and push. Okay, good. Now I'm going to try to push your legs down. I'm going to start with the right leg and don't let me do that, okay? Okay. Now try to other leg. It's perfect. Go ahead and listen to your belly. It's going to feel a little bit cold. You can definitely just breathe normal. going to percuss. And slowly I'm going to palpate. Let me know if you feel any kind of pain. Were you feeling some pain here?
No.
Okay. Going to go ahead and have you sit back on the table and we'll talk about the results. Alright, I'm just going to go ahead and take off these gloves. And I took some pictures of a few spots that I thought they were a little bit concerning. Now we have them in your file and we're just going to compare them with 6 months from now. I'm gonna have you come back. Okay, so it's May, kind of like December.
Mm-hmm.
Okay. Perfect. Do you have any questions for me?
Nope.
All right. Thank you so much for coming in, and I'll see you soon.
Thank you.